We're here today at the opening of our new harm reduction hub within the city. We've operated a needle exchange in Belfast for around the last 4 years out of our Rosemary Street site, but we're currently just relocating that site to a bigger and better building and facility. That means that we're going to be able to provide enhanced services here, so as well as our needle exchange service, we will have access to consultation rooms that will allow us to talk with our service users, or let the service users have somewhere safe, confidential, to talk about problems and issues that they're being affected by. It'll allow us to refer people on to other services in the city, so to access treatment maybe at an earlier point in time in their drug using. And we can also talk about their blood-borne virus issues and refer them on for testing and help support and treatment with those problems. So I guess we identified the Rosemary Street site initially because that's where we had encountered street injecting drug use through our outreach service. Also, as part of the needle exchange process, we gather information like the first few digits of someone's postcode, and that goes to inform then where people who are using needle exchange services, where they live, and that's where we then aim to provide a service where it's needed.
Unfortunately, across our population, not just in Belfast but wider across Northern Ireland, alcohol and drug use, the consumption of substances is increasing, and we see that day and daily in the Belfast city centre area. And we have an issue locally around polysubstance use, where individuals are using more than one substance at a time, and with that comes vulnerability. With that comes stigma, and also the potential for harshness of society to ostracise individuals who have those experiences, and largely because people don't always understand or potentially have some fear and anxiety around individuals in that space. This service creates a compassionate, friendly space to overcome some of those challenges. Staff who have empathy, who are compassionate, and who are skilled and experienced at what they do and engaging people in the right way. It's not just about the service we provide. Importantly, it's about how we provide that service. And I think that's what this facility enables Extern to do. It enables them to look after our local population, particularly individuals who might be more vulnerable, and it also provides a way in which Extern can look after their staff in a safe, secure way as well.
In Extern, we very much believe that no one organisation is going to solve this problem alone. We believe that it needs it's a health issue and it needs a health response, and we need to work in partnership with all the stakeholders in the city centre. So with Belfast City Council, with the Safer Neighbourhood teams, with the PSNI, with street cleansing, all of those agencies have their part to play. And I'm glad to say that in the last number of years we have seen collaboration and partnership working increase in the city, and we work very closely with all of those partners.